Consequences of Child Abuse and Neglect. Produced by Upstate New York Shares. Child Abuse. Overview. Any intentional harm or mistreatment to a child under 18 years old is considered child abuse. Child abuse takes many forms, which often occur at the same time. Physical abuse. Physical child abuse occurs when a child is purposely physically injured or put at risk of harm by another person. Sexual abuse. Sexual child abuse is any sexual activity with a child, such as fondling, oral genital contact, intercourse, exploitation, or exposure to child pornography. Emotional abuse. Emotional child abuse means injuring a child's self-esteem or emotional well-being. It includes verbal and emotional assault, such as continually belittling or berating a child, as well as isolating, ignoring, or rejecting a child. Medical abuse. Medical child abuse occurs when someone gives false information about illness in a child that requires medical attention, putting the child at risk of injury and unnecessary medical care. Neglect. Child neglect is failure to provide adequate food, shelter, affection, supervision, education, or dental or medical care. In cases, child abuse is done by someone the child knows and trusts, such as an educator, a priest or nun, a caregiver, a parent, Boy or Girl Scouts leader, sports activity or organization leader, a relative, a person of authority, etc. Long-term consequences of child abuse and neglect. Aside from the immediate physical injuries children can experience through maltreatment, a child's reactions to abuse or neglect can have lifelong and even intergenerational impacts. Childhood maltreatment can be linked to later physical, psychological, and behavioral consequences, as well as costs to society as a whole. These consequences may be independent of each other, but they also may be interrelated. For example, abuse or neglect may stunt physical development of the child's brain and lead to psychological problems, such as low self-esteem, which could later lead to high-risk behaviors, such as substance use. The outcomes for each child may vary widely and are affected by a combination of factors, including the child's age and developmental status when the maltreatment occurred, the type, frequency, duration, and severity of the maltreatment, and the relationship between the child and the perpetrator. Additionally, children who experience maltreatment often are affected by other adverse experiences. For example, parental substance use, poverty, and/or domestic violence. Symptoms of child abuse. A child who is being abused may feel guilty, ashamed, or confused. He or she may be afraid to tell anyone about the abuse, especially if the abuser is a parent, relative, person of authority, or family friend. That's why it's vital to watch for red flags, such as changes in behavior, such as aggression, anger, hostility, or hyperactivity, or changes in school performance. Reluctance to leave school activities, as if he or she doesn't want to go home. Depression, anxiety, or unusual fears, or a sudden loss of self-confidence. Withdrawal from friends or usual activities. An apparent lack of supervision. Self-harm or attempts at suicide. Frequent absences from school. Rebellious or defiant behavior. Attempts at running away. Specific signs and symptoms depend on the type of abuse and can vary. Keep in mind that warning signs are just that, warning signs. The presence of warning signs doesn't necessarily mean that a child is being abused. Physical abuse signs and symptoms. Unexplained injuries, such as bruises, fractures, or burns. Injuries that don't match the given explanation. Sexual abuse signs and symptoms include sexual behavior or knowledge that's inappropriate for the child's age, pregnancy or a sexually transmitted infection, blood in the child's underwear, statements that he or she was sexually abused, inappropriate sexual contact with other children. Specific signs and symptoms depend on the type of abuse and can vary. Keep in mind that warning signs are just that, warning signs. The presence of warning signs doesn't necessarily mean that a child is being abused. Emotional abuse signs and symptoms include delayed or inappropriate emotional development, loss of self-confidence or self-esteem, social withdrawal or a loss of interest or enthusiasm, depression, avoidance of certain situations, such as refusing to go to school or ride the bus, desperately seeks affection, a decrease in school performance or loss of interest in school, loss of previously acquired developmental skills. Neglect signs and symptoms include poor growth or weight gain or being overweight, poor hygiene, lack of clothing or supplies to meet physical needs, taking food or money without permission, hiding food for later, poor record of school attendance, lack of appropriate attention for medical, dental, or psychological problems, or lack of necessary follow-up care.
Child abuser behavior. Sometimes, a child abuser's demeanor or behavior sends red flags about child abuse. Warning signs include a child abuse perpetrator who shows little concern for the child, appears unable to recognize physical or emotional distress in the child, blames the child for the problems, consistently belittles or berates the child, and describes the child with negative terms, such as worthless or evil, expects the child to provide him or her with attention and care, and seems jealous of others getting attention from the child, uses harsh physical discipline, demands an inappropriate level of physical or academic performance, severely limits the child's contact with others, offers conflicting or unconvincing explanations for a child's injuries or no explanation at all. Child health experts condemn the use of violence in any form, but some people still use corporal punishment, such as spanking, as a way to discipline a child. Any corporal punishment may leave emotional scars. Behaviors that cause pain, physical injury, or emotional trauma, even when done in the name of discipline, could be child abuse. Physical health consequences of child abuse. Some long-term physical effects of abuse or neglect may occur immediately, such as brain damage caused by head trauma, but others can take months or years to emerge or be detectable. There is a straightforward link between physical abuse and physical health, but it is also important to recognize that maltreatment of any type can cause long-term physical consequences. Childhood maltreatment has been linked to higher risk for a wide range of long-term and/or future health problems, including, but not limited to, the following: diabetes, lung disease, malnutrition, vision problems, functional or activity limitations, heart attack, arthritis, back problems, high blood pressure, brain damage, migraine headaches, chronic bronchitis, emphysema, chronic obstructive pulmonary disease, cancer, stroke, bowel disease, and chronic fatigue syndrome. Physical health consequences continued. Child abuse and neglect also has been associated with certain regions of the brain failing to form, function, or grow properly. For example, a history of maltreatment may be correlated with reduced volume in overall brain size and may affect the size and/or functioning of the following brain regions: the amygdala, which is key to processing emotions; the hippocampus, which is central to learning and memory; the cerebellum, which helps coordinate motor behavior and executive functioning; the orbitofrontal cortex, which is responsible for reinforcement-based decision-making and emotion regulation; and the corpus callosum, which is responsible for left brain, right brain communication and other processes such as arousal, emotion, and higher cognitive abilities. Psychological consequences of child abuse include diminished executive functioning and cognitive skills, poor mental and emotional health, attachment and social difficulties, and post-traumatic stress. Behavioral consequences of child abuse include unhealthy sexual practices, juvenile delinquency leading to adult criminality, alcohol and other drug use, and future perpetration of maltreatment. Societal consequences of child abuse. Although the physical, psychological, and behavioral consequences of child abuse and neglect weigh heavily on the shoulders of the children who experience it, the impact of maltreatment does not end there. Society pays a price for child abuse and neglect in both direct costs for hospitalizations, foster care payments, and indirect costs for long-term care, lost productivity at school, juvenile and criminal justice systems costs. A study by researchers from the Centers for Disease Control and Prevention, the CDC, developed estimates using the year 2015 data for the cost of child maltreatment in the United States. for non-fatal incidents of child maltreatment. The researchers estimated a lifetime cost of $100,000 per child, and for fatal incidents of child maltreatment, it estimated a lifetime cost of $16.6 million per child. It appraised the annual cost of non-fatal child maltreatment in the United States to be $428 billion, based on the number of substantiated cases of non-fatal maltreatment, or $2 trillion, based on the number of investigated instances of non-fatal maltreatment. The costs in this study include both tangible costs for child welfare, health care, juvenile justice, and intangible costs for pain, suffering, and grief.
Prevention of child abuse. You can take important steps to protect a child from exploitation and child abuse, as well as prevent child abuse in your neighborhood or community. The goal is to provide safe, stable, nurturing relationships for children. For example, offer a child love and attention. Don't respond in anger. Think supervision. Know a child's caregivers. Teach a child how to stay safe online. Reach out. If you worry that you might abuse someone else's child, or your own child, seek help immediately. The phone number to the Child Help National Child Abuse Hotline is 1-800-422-4453. The phone number to the Prevent Child Abuse America is 1-800-244-5373. Or, depending on the situation, you may be able to contact your local police department, social services department, or healthcare provider. They may be able to offer a referral to a parent education class, counseling, or a support group for anyone involved to help learn appropriate ways to deal with the situation. If you're abusing alcohol or drugs, ask your doctor about treatment options. If you were abused as a child, get counseling to ensure you don't continue the abuse cycle or teach those destructive behaviors to someone else's child or your own child. Remember, child abuse is preventable, and often a symptom of a problem that may be treatable. Ask for help today. In conclusion, child abuse and neglect can have devastating and long-lasting effects on a child and can result in detrimental societal impacts, including high costs for services and increased involvement in the juvenile and criminal justice systems. However, communities can act to stem the effects of maltreatment and even prevent it. Evidence-based services and supports can promote protective factors that mitigate the effects of maltreatment as well as provide families and communities with the tools to stop maltreatment before it occurs. Child welfare agencies can work with families and communities to spearhead